All right, welcome. Today we're doing something a little different. We're going to become visual detectives, and our whole mission? To solve the mysteries hidden deep inside one of the body's most complex and vital organs, the liver.
So, here's the central question for today's case. If your liver is in trouble, how on earth can doctors figure out what's wrong without actually, cutting you open? Well, the answer is pretty amazing. It lies where medicine meets some serious detective work. You see, it turns out the liver has this secret language. When something's wrong, it doesn't just send out signals we can't see, it literally changes how it looks. And over the years, radiologists have become experts at reading these visual clues, turning abstract diseases into patterns we can actually see and decode.
And these are the tools of the trade, our detective kit, if you will. CT scans, ultrasounds, MRIs. Think of them as our high-tech magnifying glasses and fingerprint kits. They let us peer right inside the liver and gather all the evidence we need to crack the case.
Okay, first up on our docket, unwanted guests. We're talking about infections, viral, parasitic, bacterial, you name it. Each one of these invaders leaves its own unique visual fingerprint on the liver, and our job is to identify the culprit.
Now this is basically the detective's field guide. To make things easier, radiologists have given these visual patterns some really memorable nicknames. It helps them quickly ID the bad guy. So let's zoom in on a couple of these, because they're pretty fascinating.
The water lily sign. It sounds beautiful, doesn't it? Almost poetic. But in the world of medical imaging, a name this lovely points to something, well, not so lovely at all.
And here's what it means. It's a classic clue for hydatid disease, which is a parasitic infection that forms cysts in the liver. So when the inner wall of that cyst collapses, it detaches and just floats in the fluid inside. And guess what it looks like? A water lily on a pond. It's a dead giveaway for what kind of invader the doctor is up against.
All right, here's another one for you. The starry sky. What kind of trouble do you think would make a liver look like a starry sky on an ultrasound scan?
Well, this is a clue you might see in cases of acute viral hepatitis. The infection causes the liver to swell up with fluid. That's called edema. This swelling makes the tissue around the liver's blood vessels look super bright against the darker background of the liver itself. The result? It looks like bright stars scattered across a dark night sky.
Okay, but get this. Not all clues are just about diagnosis. Some of them are urgent, life or death warnings. For instance, if a radiologist spots a specific type of abscess in the left lobe of the liver, it becomes a race against time. Because of its location, it's dangerously close to the heart, and there's a huge risk it could rupture into the sac around the heart. That's a massive medical emergency.
All right, let's switch gears and open our next case file. Sometimes the problem isn't an outside invader at all. Sometimes it's an internal issue where the liver just starts storing way too much of something, like fat or iron.
And this is where it gets really interesting visually. On a CT scan, different substances create completely opposite effects. Fat is not very dense, so it makes the liver look darker than normal. Iron, on the other hand, is super dense, so a liver overloaded with iron will look unusually bright. It's this simple, black and white visual contrast that points doctors to two totally different problems.
So what can cause a fatty liver? Well, diet is a common one, for sure, but the list is actually pretty diverse. It can also show up as a side effect of chemotherapy, or from using steroids, or even as a complication from a disease like cystic fibrosis. The visual clue is just the starting point of the investigation.
And the detective work gets even more impressive with iron overload. Doctors can actually tell if the condition is inherited or if it was acquired later in life, maybe from lots of blood transfusions. How? They look for accomplices. In the inherited form, the pancreas also shows signs of iron overload, but in the acquired form, it's the spleen that gives the game away.
Okay, for our final investigation today, we're looking at what are basically internal traffic jams. The liver is this massive hub for blood flow, and when that flow gets blocked, well, it creates a very specific kind of chaos with its own very specific visual signs.
We're going to look at a condition called Budd-Chiari syndrome. Now, that sounds complicated, but the idea is simple. It's what happens when the main veins that are supposed to drain blood out of the liver get clogged up by a clot.
So let's follow the chain of events. A major exit gets blocked. That means blood can't get out. So it backs up, and the liver gets incredibly swollen and congested. It's like a dam bursting in reverse. And all of this intense pressure creates a very clear telltale pattern on the scans.
In that pattern,
It has one of the most famous and frankly weirdest nicknames in all of radiology. The result of this massive internal traffic jam is known as the nutmeg liver.
Why nutmeg? I know, it's strange, but it's because the severe congestion creates this mottled, patchy appearance of high and low density on a CT scan, and it looks just like the cut surface of a nutmeg seed. The moment a radiologist sees that pattern, Budd-Chiari syndrome shoots to the top of their list of suspects.
So, as we wrap up our investigation for today, the big takeaway is pretty clear, right? Learning to read the liver is all about the power of seeing patterns.
Starry skies, water lilies, nutmeg livers, these aren't just quirky medical terms. They are precise, visual language. It's a language that lets doctors see what's gone wrong, understand why, and ultimately make decisions that can save lives, all without ever making a single cut.
And this really leads to a final, pretty exciting question. Our ability to see inside ourselves, our imaging technology, gets more powerful every single year. We've cracked the liver's secret language. So as our vision gets even sharper, what other medical mysteries, currently hidden deep inside us,